when you talk digital tools, even before I use any digital tool, as simple as WhatsApp, I'm concerned about where is my data going to? What are they doing with it? NDPR 2019, it was a regulation. Now we have an act. So organizations now know the implication. If there's a data leak, there's a data breach, it will cost your organization about 2% of your annual revenue. What? It will cost your organization about 2% of your annual revenue.
Everyone, and welcome to another riveting episode of the Break It Down podcast, brought to you by Nigeria Health Watch. My name is Asari Ndem.
I'm Chibuike, and we're excited to have you for another insightful conversation.
Exactly. So today we're discussing a topic that affects everyone, access to healthcare. More specifically, how digital tools and technologies are helping to bridge the gaps in access across Nigeria. So from telemedicine to mobile apps like the ones attached to our health insurance apps, digital platforms are changing how we receive and even think about healthcare.
Yeah, absolutely. I mean, these tools, while they offer promise, really, they also come with those challenges. Mm-hmm. You know, not everyone has access to quality internet that these tools need for you to make the most of them. There's also the issue of trust, because it's easy to engage with someone, just chatting with the doctor and you get recommendations. Sometimes you wonder who is on the other end, who is talking to you. Maybe it's just a bot or one code. But yeah, those issues are there. Issues around data privacy. Where is your info going? Who has access to your info and all of that? Literacy. If you don't know how to navigate all those platforms, it becomes a challenge. But yeah, these are the things we want to explore today, and, to look at both the opportunities, but also the challenges. And we're really excited to, be here.
Yes, to help us break it all down, we have a special guest in the studio. His name is Mr. Solomon Chinedu, and he is what I would like to refer to as a digital health advocate who has worked extensively on tech-enabled healthcare initiatives in Nigeria. Welcome to the Break It Down podcast.
Thank you so much, Asari and Chibuike. I'm very excited to be here.
We're excited to have you.
Thank you.
So let's start with the big question, like from the top. We're here talking about digital health. Again, we're saying we're breaking it down. So what exactly is digital health when we, come to think of it? What exactly, when we say digital health, what does it mean? Or digital health tools?
Okay. So thank you so much, Chibuike. Let me start by saying health, we know what health is. So when you have to deliver health services, maybe in a healthcare facility, go see a doctor one-on-one. Mm-hmm. We understand that. So once we bring in digital, we're saying via any digital platform. So digital health implies health services provided via digital platform. The use of the word digital now implies that technology has been brought into it. Mm-hmm. Okay, so digital health tools refer to technologies that help people access, receive, or manage healthcare services using, of course, those digital platforms. It could include mobile apps, telemedicine services, much more recently, AI-powered virtual assistants. I know we'll still talk about AI because there's this thing about AI and all of that. Then SMS. So as simple as SMS, the SMS-based health platforms, but as much as it's SMS, it's still via a mobile phone, so it's digital. And we also have other health data management systems, essentially at healthcare facilities or other platforms where people can leverage to either receive, manage, or access healthcare.
That's very helpful.
Receive, manage, access.
Yeah, thank you. I think that's very helpful to, help us in understanding how to contextualize it. When you say like SMS based, I remember while I was doing NYSC, we had this thing called U-Reporter or U-Reports, where they used to collect data from us quite literally via SMS.
Yeah.
So
it's still on.
do they still use it?
I do receive. It's been a while I received, but I know I signed up to it one time and I used to receive SMS from them.
Love that. So could you give us some examples of some digital health tools that are currently moving the needle in Nigeria?
Okay. So maybe before I go to that, let me also add that interestingly, most people already use digital health tools even without knowing it.
Exactly.
So from some people use WhatsApp to book appointments.
Yes.
So it's a digital health tool.
That is.
Yeah. So while some people could use WhatsApp for social, for messaging and the rest of them, once you're able to use it to book an appointment for that particular point, it is a digital health tool. Some use it to also have engagements with healthcare professionals.
Yeah.
And then they also receive medication, and then even medication reminders, okay, via SMS. Then there's the USSD. Okay, so beyond WhatsApp as well, so USSD star. There are some other digital health providers that leverage the platform.
Yeah.
I will speak more on that as we go on. Like for us at mDoc, there's also that SMS based and USSD way by which our members or new users can also receive codes that they can use to sign up on our complete health platform. Then in terms of a few examples that stand out, it says charity begins at home. So maybe let me start with the one I'm most familiar with. We have NaviHealth.ai. It's a digital patient directory.
Okay.
And I encourage people to check it out.
Sorry, can you break that down for me?
Yeah,
What do you mean by digital health directory?
So more like Google for Health. Yes.
Interesting.
So we know that when people think about searching for any information, they think Google. So when you think about searching for health-related information, but in this case, healthcare services, healthcare providers,
I see.
healthcare facilities, you think NaviHealth.ai.
Wow.
Oh, that's interesting.
Yes.
Because when I think of looking for things on Google when I'm ill, the first thing is usually I have a headache, and the next thing I'm seeing probably a brain tumor. I'm like, oh my God.
Yeah, it's often said that thing you're looking for on Google,
You'll find it.
You'll find it. So
Right.
for us, NaviHealth is more like connecting healthcare consumers, healthcare users. We don't want to call them patients. Healthcare consumers with healthcare facilities. So while you're at home, you're thinking, I have a headache. Where do I go to? I don't know where to go to. I don't want to go to Google, where I'll see lots of information that I may not be able to.
Yeah.
So I go to NaviHealth.ai and you search for a facility. You can search either by specialty. You can search either by condition. You can search by provider. So it's more
How
like
about by proximity?
yeah, so the idea is because it's a geocoded platform, the facilities there are geocoded. When you search for based on your search, you will impute your location.
Okay.
And then it will bring out options for you based off proximity to your location. And then you can then select where to go to. And interestingly, when you visited that facility, you can return back to NaviHealth and tell them how well they served you. So there's a feedback mechanism on the platform for people to rate the quality of care that they have received. Then we also have government-led initiatives. Good to mention that, like the National Digital Health Blueprint, NHMIS, that digitizes health data for better policy and delivery. And also good to mention states like Lagos State. They have this Lagos State Smart Health Information Platform called SHIP, aimed at improving healthcare delivery in Lagos.
How does it do that?
So it's more like for Lagos, it's about digitizing all their healthcare facilities, and then having a central platform for where. So rather than have different health platforms that provide different services centralize it in one place.
Okay.
So you have an EMR that has a linkage to, very excited to announce, has that linkage with NaviHealth. So someone wants to provide feedback to public facilities in Lagos. There's a place where you can put that in. It's also linked to LASHMA, also linked to LASRA. So that sort of interconnectivity. So rather than
what is LASHMA and LASRA?
So LASHMA, Lagos State Health Insurance Management Agency.
Oh, I see.
Okay.
Yeah, so it's more like they have different. I'm not the expert on that part, but I know it's more like the state's owned insurance scheme, ensuring that healthcare is accessible to every resident in Lagos at the lowest possible cost. Then LASRA, I think, is the identity, the identity management agency of the Lagos State government.
Okay.
And so it's more like every data point, everything that a resident of Lagos requires to access either quality healthcare within, to start with maybe primary healthcare. It is centralized in a way that if you log on to the EMR, there's a consumer facing side. I can't speak much on that because I don't know much, but it is much more centralized. So the SHIP is the initiative helping the Lagos State government through the Lagos State Primary Healthcare Board to consolidate these digitization efforts. Yeah.
It's really interesting to see how these initiatives they're not just private sector led, to see that there's also the public, interest and actual investment in them. I was going to talk about reach. So in all of this, how much are people in rural areas benefiting? Of course, we started this by saying, there are benefits, but then challenges. But I wouldn't want to put the words in your mouth. I'm just interested to know, in terms of reach, how do they benefit from this? And also the NaviHealth. I was going to ask, so you said it's geotagged and all. So, but what's the range? So the facilities you've onboarded that people can find, is it across the country, or you're starting, state by state and, scaling up the coverage?
Okay, thank you so much, Chibuike. You mentioned reach. So let me start from by making this statement that one of the major wins of digital health in Nigeria is its ability to leapfrog those traditional barriers. And in our own use case, we've seen it, working on several projects, targeted towards reducing maternal mortality. There's always this perception that some of these digital tools will be able to use them. The traditional literacy, digital literacy, some of these things could be existing gaps. But we've seen that both in urban cities like Lagos, in urban places like Abuja, and then you have some other remote areas, even within Lagos, and then places like Kaduna, Zaria, Kano, people are able to use these tools. Back to your question around Navi and in terms of reach. So currently we have over 50,000 healthcare facilities geocoded on the platform, cutting across all 36 states plus FCT on the platform. And across different cadres. So you have primary facilities, you have secondary, you also even have wellness centers, diagnostics, pharmacies also onboarded on the platform. And then in terms of usage, so even, especially from a project, perspective, we've seen that more people, even those that we rarely believed, health facilities or health administrators in these facilities will say, some of our people have issues using some of these tools. And then it's more around awareness. So why a woman in Lagos is able to use these facilities, the platform, women also in Zaria, women in very remote areas are also able to use these digital tools. So it's how well you're able to make it simplify the process. Using NaviHealth is as simple as ABC. Anyone is able to use it. And so, I hope I was able to answer
thanks
question.
for that. I mean, it reminds me of something someone said about innovation, and it's not really about, all those fancy tools and complicated stuff. Even, I like that you even mentioned SMS as an example. So, innovation is not necessarily something fancy or complicated. So as simple as possible, as long as it's helping make access easy.
Yes.
It's an innovation. So thanks.
Let me also add this. We have, because we did also mention AI virtual assistants. At mDoc, we have a platform called Complete Health. It's a virtual, is an omni-channel that we use to provide self-care support.
Omni-channel.
So omni-channel implies omni.
Break it down.
Yes, break it down. Sorry. I almost broke that rule. So omni, all encompassing.
Oh, wow.
Everything where you define, they there.
Interesting.
Yeah, so that's why it's called Complete Health. So it's used to provide virtual self-care support to people who are either living with or at risk of chronic health conditions. Okay. And then people with regular health illnesses. Now, the big thing I wanted to emphasize is on the Complete Health platform, we have our AI chatbot called Chem. So those who are members who have been able to download the completed app can interact with Chem, ask questions around their health issues. So the big thing now is Chem speaks pidgin.
Interesting. Speaks or writes?
Speaks. I know what I was saying. Okay. It speaks. So there's the voice to text and text to speech.
Text, okay.
So in terms of, the woman who does not understand English can speak in pidgin and Chem will respond in pidgin, speaking to accessibility. Yeah. So it's more about how can we make these tools very accessible, low bandwidth, and then available in a local language that can really facilitate usage.
Wonderful. Okay, so let's talk about the other side, right?
Okay.
Generally, what are some of the challenges you've experienced in implementing digital tools in Nigeria?
Okay. So I will start from home and then go broadly. Because when we talk about these digital tools, it's not just restricted to one. So I would say the first thing would be infrastructure.
Okay.
So at the end of the user, because you're thinking about the user, what are some of these challenges that will prevent them from using these tools? So you think about infrastructure like even access to a smartphone. Okay. But it's great that the smartphone penetration in Nigeria is actually very high currently. So now there are people who now have the smartphones. Can they use the smartphones? Okay. Then you talk about issues like internet connectivity. We're getting there. But there are times when you're on your phones, you're either joining a meeting or anything, then the internet just disappears for no reason. So at the point where you want the user to use your app, that may be the time the internet may have disappeared. So that's a huge challenge, especially in rural areas. And then we have digital literacy, which is now even different from traditional literacy. So I went to school, no problem. Okay. But can you use a smartphone? Not everyone who has gone to school can use a smartphone. And then in bridging this gap, it's around awareness, sensitization across the healthcare facilities, across using different medium to sensitize people and guide people. Since usage of these digital tools are easy, it's about just getting them to understand that create flyers, create things to say, okay, do this, and you're able to use them. And then the language part. So at first, for people who may not be able to, especially traditional literacy English, if those tools have been created in English format, in Queen English, and they can't they can't relate, it's also a problem. Then there are also design issues. And then all of these things are still tied down to funding and sustainability.
Of course.
So because these digital tools, they cost money to keep developing and keep sustaining them. And so in partnering with the government and helping provide these tools to make sure that people can access them, it comes with a cost. So some of those are, of course, the organizations that will say, I would love to do this great thing, do this wonderful thing, but the funding may not be the issue.
How about trust? I mean, also speaking from your own experience, building and deploying these tools, do people really trust these tools? What are you seeing, especially for communities that are very traditional, who are still used to the normal, face-to-face interaction with health practitioners? What are you seeing?
Yes, trust is a big issue. Because at the end of the day, people just have that perception that I'm speaking or I'm interacting or I'm using something that is not human. So the reliability of that platform is to the extent to which the owner or the creator has told you. Okay? It's technology. So it's more around, take, for instance, our CAM chatbot. People, you're talking to a health coach. You've been told this is a health coach. It's now knowing to what extent can I trust with regards to my health? To what extent can I trust this chatbot? Okay. And so the thing is, there's always that human in the loop, combining AI with human support.
Okay.
And then ensuring that the information we co-design with the community that we serve. Very important to know that. So you don't just import. It's different from when you're buying a soap. You just import the soap and people use. But for these digital health tools, especially since it relates to something as critical as health, when you co-design with them, is very important. Okay. Take, for instance, we created CAM. Then we tested with the community. We got feedback like, a woman saying, I can't type. And then we say, but you have WhatsApp. Say, yes, I have WhatsApp, but I use voice note. So now saying, I would love to speak with Kem if you people can do it. And then we'll come back and say, you can now speak with Kem. There's no better way to build trust than that. They know that these tools are for them. You understand their pain points, and it's about building in a way that addresses their challenges. And then for NaviHealth, it's very simple, straightforward. Search for the facility. If you don't find the facility, no problem. Tell us. The next time you come back, you'll see that facility on the platform.
Okay. So for me, and I guess other people as well, data privacy or data privacy issues are a big thing. So what are we doing to address that specifically? Okay.
Thank you. Very important question. When you talk digital tools, even me, even before I use any digital tool, as simple as WhatsApp, I'm concerned about where is my data going to?
What are they doing with my information?
So organizations, it's very important that we take data privacy seriously in the country. The good news is, and the Nigerian Data Protection Commission, now they take it seriously. Not that they were not taking it seriously, but NDPR 2019, it was a regulation. Now we have an act. Yeah. So organizations now know the implication. So if there's a data leak, there's a data breach, I think almost 2%, it will cost your organization about 2% of your annual revenue. So people now know.
That's a lot of money.
Yeah, they know the implication. So it's no longer a time, I don't know. So for NDPR, it's more about how you safely and legally process people's data. At mDoc, like I mentioned, like you introduced me at the beginning, I lead data protection at mDoc. And we're among the first digital health organizations that got recognized by the Digital Health Department of the Federal Ministry of Health around our compliance with data privacy. So just ensuring that those strong security frameworks are there and you collect consent. People know what you do with their data. They know where that data rests. And of course, they always know that at any point in time, they want to say, don't use my data for anything. Even though I've given you my data, I want to take it back. It's very important. And then just protecting people's interest. Anyone coming to your platform to sign up is doing that, knowing that they trust that they can securely have their data rest in your database. And so it's very important. And thank God for the regulators really ensuring that companies now are very serious about that.
Awesome. So we talked about the current landscape, but in all of this, what does the future look like?
Okay. Let me just start by saying we're going to be seeing more and more of these things coming. More tools are going to come up, pop up, in the spirit of breaking it down. More things will come up, pop up. Every day you go to Play Store, Apple Store, or web platforms, you see different innovations. And that speaks to the ingenuity or the willingness of Nigerians to embrace technology, because we know that, for instance, AI has come to stay. Mm-hmm. And rather than play catch up like we usually do as a country, it's more like, how can we be the early users of these things so that if we want to fail, we can fail early, fail forward, learn from these things and move on. So we're going to see more AI-driven decision support tools, more personalized self-care pathways, and more tools that even make it very easier for people to use some of these tools. And then for a platform like NaviHealth.ai, with all of the integrations that were and partnerships, collaborations with governments, Lagos State, Kaduna State, the idea is how can we translate, for instance, NaviHealth, I mentioned the feedback aspect where you can give feedback and the healthcare facility can use that feedback, turn it into a change idea and improve the quality of care. Awesome. We've had some users say, we want to be able to give our feedback in our own language, in our own voice. So the future is very, we're optimistic about it. Awesome. As long as usage is there, as long as the right partnerships and support is there, then anything is possible.
Wonderful. And for digital tools to, I guess, truly scale, what kind of partnerships should we be looking for? What kind of role should the government or civil society or even the private sector play in this?
Okay. Thank you. So the government has a huge responsibility, and that is to show, in the spirit of public-private partnership, to show that, yes, we're ready to support private entities that come in and invest in technologies that can help make the lives of Nigerians easier and better. And so government, in terms of investing in infrastructure and adopting, they can adopt or adapt. But look at those scalable platforms. Like I mentioned, our partnership with Lagos State government, through the Primary Healthcare Board and the Lagos Ministry of Health. Very fantastic. And then civil society can also help in sensitization. Why people are scared to use some of these digital tools, you come in because you've used them, because you understand. You can now say, guys, can we use, this is great. So if you want to know which facility to even visit and you're not sure, go here. These things are, to a large extent, they are safe and you can continue to use them and then provide feedback to the platform owners to continue building digital literacy. And we mentioned trust building. That's really where civil societies also come in. And then private sector, just investing in user-centered solutions. User-centered, the user at the center. I often say, as a business person, I can't produce what I like. I have to produce what the users like. So it's about them, using human-centered design in creating solutions. And then smart partnerships. For instance, digital health tools require internet services, smart partnership between telcos, health providers, tech innovators. So, especially in digital health, healthcare facilities, knowing that healthcare facility can go to NaviHealth and create a profile, making it much more easier for healthcare consumers to find them And when users provide feedback, you take it that, oh, these people are interested. They really want me to improve the quality of care that I provide to them. Yeah.
Are those feedback public? Just quick. Are they public?
Yes, they are.
So it doesn't go to their inboxes. Others can see the feedback.
Yes, others can see the feedback.
Okay.
Yeah.
Wow, this has been really amazing conversation. I'm really thankful for the insight you've shared. I mean, this is just a snippet because we know it's a whole, it's a huge conversation around digital health. But thanks for sharing those thoughts with us. You're sharing welcome. The opportunities, but of course, the challenges and what the future will look like. And it's really exciting as far as I can tell. But I think one interesting part of it was when you said we can be using these things without even realizing, right? Like WhatsApp conversations with doctor. Even doctor colleague, that's consultation.
Yes.
So thank you for sharing that. I hope this helps the person listening to realize that these tools are here to help, so we shouldn't be scared of them. We should use them to improve how we access healthcare. Thank you so much for your time.
Thank you.
Yes. And for those of us listening, whether you're a policymaker, a health worker, or just someone who's curious about health tech, remember that access to healthcare is a right, and innovation can help us be closer to that reality.
If you are listening, we want to know the digital health tools that you use. Do send us message, chat via email, podcast@NigeriaHealthWatch.com. Share your experiences with us. If you've used NaviHealth or any other digital health tool, let us know your experience.
And a huge thank you to our guests for joining us today.
Yeah, Solomon Chinedu. I am a senior associate at mDoc. I lead NaviHealth and Data Protection.
Wonderful.
Awesome.
That's it for this episode of the Break It Down podcast. Remember to subscribe, share, and tune in every other week as we unpack the issues that matter most to us.
Until the next one, stay informed and stay healthy.
Thank you very much.